tell us a little bit about kind of the origin story. Where did the idea come from? What were you thinking at that time in terms of wanting to make the pivot from what I'll call more of the, traditional job to doing something on your own?
Yeah, it was interesting for me because when I started Radical Health, I talk about community often. I really didn't know what I was doing. What I did know was that I had worked at a bunch of companies. I made a lot of people a lot of money. But it felt so far removed from where I lived, my communities like mine. And what I was doing in the day to day didn't have any impact on what I was doing at home. And so starting Radical Health really just started around my kitchen table. We brought folks, I like basically anyone I met. I was like, do you want to come over and have a chat? Like I would pull people in the subway if I saw they were wearing scrubs. I'd be like, hey, I know you don't know me, but I'm having like a chat at my house. Do you want to come over? And really started building around that and really started listening to what people were saying. And not just healthcare providers, but community members, teachers, like government folks, and just starting to listen. And it was in those conversations that people really elevated and said, like, this isn't working for me. We had one teacher who was saying, like, I teach kindergartners and their parents are coming to me and I can't do anything and I don't know how to help them, but like I'm seeing folks every day. And so Radical Health really started, I guess, in those conversations. I guess I don't want to say that I always knew that like I could do something like this. So I never doubted my ability to start a company. I never doubted my ability to even challenge a whole kind of existing healthcare system to think about doing things differently. I've always been a little bit of a rabble-rouser, you could say. But in starting Radical Health, it really became and still is a product of building with people and listening and really changing kind of the perspective to not, I don't have all the answers and I just am really good at listening and building with folks.